Hi, Alvina.
Hi.
Hi, everybody.
How's it
Welcome
going?
back to the channel. Today, I have a really special guest and also a friend for, I think, over 10 years. Let's not show our age, but we have known each other as friends and colleagues for
A long time.
the time. And the first time I met Alvina was actually at a nutritional conference. And I was curious because I was asking myself, why do I have a pharmacist sitting next to me listening about nutrition and supplements? And she was probably thinking the same thing in her own head. So this conversation. So I want to, welcome you to this channel.
Thank you very much.
And I want to sing your credentials and your accolades because I'm very impressed. She's a multi-talented person, not just a pharmacist, but a wellness practitioner. And she's very dedicated to helping her clients, her patients, and people around her to optimize their health through nutrition and lifestyle medicine. So she not only has a degree in pharmacy, but she's also certified in anti-aging medicine, nutrition, and bio-individual nutrition as well. So she has over decades of practical experience, and she's also scientifically very rigorous. So I'm excited to welcome her.
Thank you.
And also she walks the talk. That's my main motto, is to walk the talk with the doc, but I love inviting people who also walk the talk because in 2019, she was the overall champion for a local natural bodybuilding competition and went on to place at regional, state, and national levels. So she's very passionate about resistance and strength training and HIIT as well. So when I go to conferences, not only is she my conference partner at the medical conferences, but she also keeps me accountable at travel training. So with all this decade of being able to access your knowledge and your brain, I've been very grateful to witness how you've actually right now incorporating your knowledge as a pharmacist with lifestyle medicine. So you have a forum that you've created for health providers, and it's an integrative health forum for pharmacists. And you posted something on, which is a Facebook forum, you posted something on there that really struck me because it was a case example of a 50-year-old woman who was taking medication for reflux, and specifically she was taking a drug that is known as a proton pump inhibitor. And you posted this case and started asking your colleagues, how would you approach this woman? And then some people made comments, and your approach was extremely unique. And I wanted to share this because this is what an integrative pharmacist does. It's not just a pharmacist counting pills, but it's actually a pharmacist talking to the client. Is it client or patient? I'm not sure.
You can use both. Client, patient.
So it's talking to the patient, understanding the context of what her reflux symptoms were coming from, and then you highlighted how you actually did some coaching with her, like some lifestyle strategies to manage her stress. And it really struck me because this is not something which, when I went to medical school, that's not my understanding of how I interacted with a pharmacist. Most of the time, the pharmacist might come to the hospital ward rounds and then review the medications and then, alert the doctors and say, hey, you need to rescript this medication, or you need to review this. And that's kind of how we interacted. So welcome. And I want you to help me explain, what does it mean to be an integrative pharmacist?
Yeah. Well, firstly, I'm very fortunate to be in a working environment that I can actually do what I do, spending the time with patients. And so, my approach is, I stay really curious, when I dispense a medication or, do certain counseling, I look at the person as a whole. And sometimes, really engaging. So it's not just about the medication itself. So for that woman, my question was, how long, was there a timeline? When was it that, when did this reflux worsen? And it was when she started talking about, the stress in, her life, that sort of, opened that whole conversation, and which then lead me to talk about, those lifestyle intervention. So often, like, say for example, last week, I guess that's an integrative way of not just looking at the med itself, but looking at, maybe there's certain nutrients that could actually help them, or mindful practice. For example, only a few days ago, I have a woman who came in wanting some doxylamine, which is it's an antihistamine, but they usually use it to help sleep. And she also asked for some Voltaren, which is an anti-inflammatory. And so I was really curious, because she was actually, over that, definitely at menopausal age. And I said, well, how often are you using this sleeping tablet? And I I only take a quarter to half every night. My mind was going every single night. Okay, all right. And I go, well, what about, the Voltaren? And she said, oh, look, like I get aches and pain, I go, she's obviously trying to do the right thing and, doing training and all that. And she goes, oh, sometimes I get, aches and pain because I'm lifting. And I'm like, oh, I was so happy. And I said, look, that's so good that, you're actually doing resistance exercise. But she was, I guess she wasn't actually expecting this conversation. But then, I was then able to then open up and go, well, apart from sleeping, what other, do you experience any other symptoms? And then she talked about the hot flushes and everything. I was like, okay. And so that actually then gave me an opportunity to actually say, have you actually looked at hormone replacement treatment or hormone treatment? And so she walked away, feeling, I believe, more empowered, because she knows that, okay, well, while the sleeping tablet, yes, is going to give me, give her this temporary relief or helping her sleep, but it's really not a fixing issue. So I said, look, exactly, going upstream. And so I really encouraged her to then make an appointment to talk to a doctor. I said, look, make a separate appointment, a consult, and talk about this. So that is, my approach. And quite often, I mean, I don't really think...
Can I just interrupt and ask, because the approach that your other colleagues would be comfortable doing, or is this also a bit different and outside of, like, you would have to learn coaching skills or interviewing skills to do that? I don't know. I guess, I've always been curious, because I'm curious as to, why are they feeling this way? Why are they taking this, and how long? And so maybe it's just, throughout the years, I've acquired some skill that I don't even appreciate myself, to learn to talk, and also to learn to really listen. And pause and really taking the time. One of the feedback I get from patients is that, and they walk away before they go, and they go, well, thanks for listening. And I just felt like that, but that's what I do. So it's really interesting, because that case that I saw that you write up, this lady was saying, oh, this might sound really silly, and your reaction to that was, I've heard a lot, I see a lot of things, try me, and you just opened up the floor for her to feel safe to talk to you what she was going through.
Yes, totally non-judgmental. Like, so I just want them to feel like, I'm not judging at all. Like, say what you have to say. Because I think we're not here to bag about, medications. They have a role, they have a place. I think it's about, I think it's about, I know that there is a role and place, and this is why modern medicine is so fantastic. But then at the same time, we're also dealing with a lot of chronic medical conditions. And as a result of that, we have a growing population of people who are actually, the average age of a 50-year-old who's taking 80% of 50-year-olds are taking one prescribed medication,
and and even more over-the-counter medications. And then about 28% are actually taking 3 or 4 prescribed medications. So there is a growing trend that more people are on multiple medications. But we also recognize that a lot of these chronic conditions, people are looking for answers and trying to do the right thing. So this is why I think it's so important now that we need to have a shift in the way that we approach some of these chronic conditions. So that's why I think that, our roles as, traditional, just seeing the patient, treating the symptom, and then they walk out the door is probably not really adequate to address these things. So it's fantastic what you do. And but also there are some pitfalls. And the reason why I say this is because the supplement industry, people are buying supplements online, they're purchasing by themselves because they've heard a friend recommend something, especially now with menopause. There's a growing number of supplements that women are advised to take, and yet it is $170 billion industry, and it's going to almost double in the next 5 years. And there are some pitfalls that I want to discuss with you because this is also in your wheelhouse. And I want to first start by introducing this idea of what is a drug-nutrient interaction or depletion. Can you sort of these are some of the things that I see also in practice where people are taking drugs and medications or drugs on their own, and they're coming up with some nutrients that are suboptimal.
So this is an area that I find very fascinating and definitely need to be addressed. So I'll probably just go with some of the examples, like more common examples, and to spell out, like drug nutrient depletion and how soon it can actually occur. It's not, it doesn't take years. Sometimes it can take, even just, as little as 6 months or so to happen, especially, with blood pressure medication. For example, your, we call ACE inhibitors like ramipril, perindopril. It could actually dysregulate, for example, your zinc levels. So researchers have found, one of the signs that could show changes is, your sense of taste. So food seems to be more tasteless. So this class of, blood pressure lowering medication is also very commonly used in diabetic patients and with patients with congestive heart failure. And they have actually more propensity to actually excrete more zinc, which is quite interesting. And so it becomes more important to be actually watching out for clinical symptoms. So as I mentioned before, some of the symptoms could be, loss of smell or taste, poor wound healing, and also, maybe some white spots on the fingernails. And if these patients, because, now we're promoting this plant-based diet, and if these patients, I'm not bagging it, so, if these patients are actually consuming plant-based diet, and if they're not mindful of their micronutrients, they're actually more susceptible to a low zinc status. So that's really a double whammy effect. So, and beta blockers, so that's another class of medication that you have to actually really look at, for example, your coenzyme Q10, and melatonin that it could actually affect sleep. So, for example, sometimes, as a pharmacist, our counseling points, like we would talk about beta blockers, and, my colleagues and myself would say, look, these medication can actually make you feel a bit more tired. Or it can actually disturb sleep. And when you actually really, and this is where I find it actually quite fascinating. So when I then dive into the why, and you actually understand because, it actually deplete your coenzyme Q10, and that's why you feel tired. And because, why you're not sleeping well enough, because it actually affects your sleeping hormone. Now, and I'm actually seeing more propranolol, which is a beta blocker being used for anxiety. So you're actually seeing younger patients, because, they're probably not, I think, practitioners trying not to use things like Valium or Xanax. So you're using propranolol. So even doses, they're not as high, so we're talking about doses as low as 30 milligram, which is actually quite low, can actually inhibit this mitochondria coenzyme, CoQ10. So, well, why should we care? Because, coenzyme Q10 plays a really central role in, energy production in cells, but of course, most importantly in muscle cells, especially those of the heart.
Yes.
And also, so as I said, we counsel patients about the fatigue, and having low CoQ10 can also mean, reduced contraction of the heart and decreased cardiac output and other reduced cardiac function. So you think that, these people, they're already having heart issues.
Yeah.
So it's actually really non-ideal. So co-prescribing CoQ10 for these patients with cardiovascular condition, may not be a bad idea, and may actually potentially enhance, a better health outcome. But of course, you need to speak to your healthcare providers about that. And of course, CoQ10, I think the most notorious, and a lot of people know, another class of medication is actually statin, which is your cholesterol lowering med. So, patients can also, apart from fatigue, they can actually complain about muscle pain. And I mean, not everyone.
Yeah, this is a question I have, because the question is, this is going to be the next thing, right? Like, oh, I'm on these medications. Should I just automatically go and supplement CoQ10? Or should I automatically just go and take zinc because as an insurance, maybe I could be depleted? Like, how do you navigate that? Because then you, because it's not universal, is it? Because there are certain populations who are more predisposed because of their...
Of course.
Yeah.
So, with zinc, you can definitely, do a zinc test. So, I mean, they're not great tests, but, generally you look at, plasma zinc. And, when a patient's about 10 to 12 on a blood test, that actually shows deficiency. So I generally look at, zinc and copper ratio. So that's something that you can actually look at. But of course, some of the clinical symptoms, you can actually go with that as well, the loss of taste and,
so it's individualizing it, isn't it? Because you've got to ask the right questions and then decide, does this person have multiple morbidities and medications that could actually be creating that reduction in zinc absorption, increase in requirements, and then saying, okay, look, if we supplement and if resources allow, because not everyone can afford these tests, sometimes they're not covered. So if resources allow, then okay, maybe we actually do, and we can identify some symptoms, maybe we actually do a trial of supplementation and monitor the outcome. So I guess this is where individualizing and asking the right question, a good clinical history is so key, that you shouldn't just go out and just take these things just because, there's a potential risk, because it can also cause problems, right? Too much zinc on its own and also cause hair loss and cause nausea and these other side effects.
A heap of different things, yeah. And of course, with CoQ10, it's actually, it could be a genetic problem for patients. If they have problem breaking down statin, then they could have a larger depletion of CoQ10. So, so some people, can tolerate, say for example, statin better, but you need to know their genetic makeup.
Actually, there's an interesting test that came up here in Hong Kong. I forget which university created it, but we were able to access these specific genetic variations and match them according to the different medications or statin medications that this person may not be able to take, and then make recommendations for other alternatives. So I thought that was, this sort of personalization of pharmacogenetics, looking at, it's a growing area, and I think it's been very helpful. So in my practice, it's very reassuring if someone actually sees it and goes, okay, well, I feel better now that I know that I'm not susceptible. So it can be very helpful.
There is definitely we call pharmacogenomic panel that you can actually do. So especially, like there are patients who are really, they have a lot of problem with medication, or they're very sensitive, so to speak, to medication. And so, perhaps, they might be lacking in certain enzymes, or they could be fast or slow metabolizer. So if you're slow metabolizer, that means that, perhaps, the normal standard dose is actually too high for you. And so if you know that genetic makeup, it's actually often quite useful to know that, okay, well, look, this patient, we're going to start with half the dose instead of the normal standard dosing. So that's actually quite useful.
Power of person.
Yeah. So there's a lot of personalized, prescribing of nutrient and also pharmaceutical. That's what the other talk about, other drug nutrient depletion. Some of the ones that that maybe we're talking about. It's the diabetic medication. I guess because that's quite common, especially in Asia as well. Well, it's common everywhere, really.
Yes, we are growing.
So
in the way to becoming, I think, almost world's number one in the percentage of people being diagnosed with diabetes and pre-diabetes. Yes.
So the most commonly prescribed medication will be Metformin, and it's very well documented that it actually really affects the absorption of vitamin B12 in the small intestine. So it also compromises, and change the intestinal the motility, the movement, changing gut movement. So folate can also be affected too. So it's actually really worth checking. I mean, those are quite easy to find out, through a blood test.
Things like fatigue, nerve symptoms.
It could be so many things. In diabetic, low B12 can also put patients at risk of diabetic peripheral neuropathy. And this can actually occur as early as 6 months into treatment. So keeping that in mind. Talking about, gut movement and all that, of course, our new class of GLP, the semaglutide, tirzepatide, they tend to slow down the stomach emptying process, which, gives you a sense of fullness. So, your appetite is going to be suppressed, which means that, the quality of food you eat really matters. And so guess what I'm going to talk about? Obviously protein. And also, so food got to be nutrient dense, high in protein to avoid, any kind of nutrient depletion and muscle loss. And so that's usually what, I try to, counsel people, and just being really mindful of, the food they eat. And these drugs also slow down the stomach emptying process and also reduce the stomach acid. So both of which are actually really necessary for B12. Actually So iron, calcium, magnesium.
Yes, all the minerals too. Yeah.
All the minerals. So it's actually a really good idea to keep these in check. So
do you recommend a multivitamin for people who are actually on GLPs?
It's probably not a bad idea. Having a multi. Again, it really depends on the patient's lifestyle, how old they are, and are they taking, because usually, if they're actually using that class of medication as a diabetic, they're going to be on an ACE inhibitor. They might be on a statin. So you're really thinking, so exactly. So you're already, having that challenge of, okay, this patient might be low in zinc already. What I talk about, the ACE inhibitor, maybe the CoQ10 might be, get gradually, even though, you may not be susceptible, but, if you're taking this medication for years and years, you're going to be depleted. If you're like CoQ10, we know that it's in offal meat, organ meats. Like how often do people actually eat that?
Well, that's a challenge, isn't it? Because we do want to encourage lifestyle. We do want to encourage good practices. Just because there's a supplement available doesn't mean that that's going to be the be all and end all. And I think that's why it's even more important that if you're on multiple different medications and on these newer classes of drugs, that you really focus on the quality of the food. So I think that's why it's so important that lifestyle and these conversations are part of the whole clinical evaluation assessment as good providers. And so that's why I so appreciate having this. The other thing I also wanted to highlight is that the GLPs can also slow down the absorption of certain medications. And so first thing was with menopause is the actual because the progesterone sometimes is prescribed orally to protect the uterus as part of hormone therapy.
Yes.
And so recently, because of the growing use of GLPs, women have been, some of the societies have recommended that temporarily we may have to increase the dose of progesterone as we are escalating the doses. So there are sort of ongoing revisions of how providers like myself have to counsel our patients and just highlight the awareness of this. But what I didn't know was actually, but what I realized, just what you brought up was also important, is that it reduces stomach acid. And so not just nutrients, but even some medications like antibiotics, which require adequate or drugs that require adequate stomach acid to be absorbed properly, that would be affected too.
Yeah, I mean, reducing stomach acid, like, once you muck around with pH, there's just so many, like repercussion. And we're also talking about obviously nutrient absorption, and also we talk about our gut microbiota.
Yes.
So, another class, actually a class of medication that they have found is, the non-steroidal anti-inflammatory as well. So it is actually very well documented that NSAID actually causes a shift of gut bacteria. And so this shift from actually gram positive to gram negative can actually aggravate and contribute to intestinal damage or injury. So, but these studies are actually mainly done on animals, and there's some on human. So, but we really need, what is actually the significance. So we really need more human studies to actually verify that.
So it goes back again, like, okay, we do have some of these mechanisms and there is a possibility, but I think it's important to highlight that if you have really terrible menstrual pain and dysmenorrhea, I think it's important that, if you're taking these medications for these symptom treatment, all the more reason why we have to take care of our gut health and eat the foods that actually the prebiotics, the fiber, the probiotics that are in food, and eating more of these foods and focusing on that is really important, because I think I don't want to create too much health anxiety around medications that are, properly prescribed and required. But I also want people to understand that, it's not the end of the line, that there's other things that we do want to do in terms of nutrition to support that as well.
Yeah, what we can do to mitigate that, potential side effect. So, for example, pain medication like opioid that is commonly prescribed, and one of the things that we counsel patients is on constipation, right? Because, they impair that intestinal contraction and it slows down the gut motility. Again, that changes that gut flora ecosystem. So it's really important to, look after the gut health. And it's important to actually note that the connection between the drugs and intestinal bacteria is bidirectional. So meaning that, not only do drugs actually shape, the composition of the microbiota, but that derangement or known as gut dysbiosis can change that pharmacokinetic of drugs. And so this really opens up the gateway into the whole world of personalized medicine. So which is really, really interesting, what's to come, because we're really in the infancy of learning about, the microbiome.
It's a combination. It's a combination of what's happening in our modern lifestyle versus also, the number of medications that we're now prescribing. All the more reason why, I always talk about fiber. I think people are sick and tired of me talking about fiber, but I think there's so many different types of fiber, and I think, a lot of people in the modern world, like around 80% are still, something ridiculous amounts are not meeting their fiber intake. I think this is all the more reason why we also have to have that conversation. The other next really common one that a lot of women are having to take or need to take is birth control pills. So that's a really important one too. And I think there's also an interaction between birth control, GLP medications, and the absorption of birth control. So again, there we're also having to advise patients on other alternative methods of contraception while they're having their medications adjusted and escalated, but also nutrients.
Well, with birth control pills or even like combined hormone therapy, it could very commonly actually raise your copper level. I mean, is this a problem for every woman? Obviously, no, because it really, again, depending on your genetic makeup and everything else. But if, the woman is actually experiencing changes in, say, even glucose metabolism, their mental health is changing, emotional changes, which sometimes we see, taking the pill is definitely worth checking their levels. As I said before, the copper level and the zinc level. So clinically, I tend to actually see a low zinc with high copper. So I always check the copper and zinc to look at the ratio, which will give me a more meaningful picture. So if copper is high, then, definitely we can actually use zinc to hopefully correct that. And also some vitamin C might be able to help as well. And the other nutrient is folate. So pills with higher estrogen doses can actually impair the folate metabolism and can cause a depletion. And so, if the woman is already compromised, in their folate status, or if they do have, one of those genetic variant, so, they're really more susceptible. And the consequences of having a, more depleted folate or, or B6 or even B12, they could then elevate the homocysteine level, and thereby increasing the risk of the patient's cardiovascular risk. So, it may be prudent to consider an assessment of these markers if there's any concern, or if that woman actually carry a cardiovascular risk.
Yes. So I would consider someone who may, I suppose there are different scenarios that I see, right? So some women have a high family history of cardiovascular disease. So as a result, we're doing the lipid panel, where we're checking for other risk factors, that including homocysteine, potentially because that's an elevation is a biomarker for increased cardiovascular risk. And then if she's also taking birth control for various reasons for contraception, then it's not to come off the birth control, because there's a reason, medical indication for it. But how can we improve diet? Does she need to be supplemented? Testing, like you said, the copper and zinc levels if she's also suddenly becoming increasingly depressed. So I think it's worth looking at these markers and baseline, and then looking, okay, can we actually incorporate more of these foods in the diet? So I think referring to a nutritionist or a dietitian who's able to coach through that, because again, most women are taking birth control for years, right? So these sort of things can crop up over a very long time. So we want it to have something that's sustainable.
Absolutely.
Yeah, and I think that's a really critical point, is it's not that we don't take the medications, but what else can we be checking and doing to personalize that successfully with minimizing the adverse.
And really optimizing, the health of the patient, and also, getting, whatever goal, that they might want to achieve with their medication. So that's the end goal.
Yeah. So that's the other question I want to actually ask is, people sometimes buy supplements, and you look at the quality of the supplement, you look at, I look at the quality, the doses, because, having, like yourself, also gone through more nutritional educations, and understanding, what's the difference between a supplement, because there's no universal definition, is there?
No, there's no consensus around those nomenclature. And depending on which country you're in, nutraceuticals and supplements are regulated by different bodies as well. So it's really murky. And often the term like food supplements, herbal extract, functional food, nutraceutical, they're all interchangeable. So it's very, very, confusing. So as the word supplement suggests, it is to supplement or add to a normal diet. So food supplement could be a single substance used alone or in mixture with micronutrient insufficiency. And it may take a lot longer to supplement before a pronounced effect can be observed. But a nutraceutical refers to a food or part of a food that provides medical or health benefits, including like prevention and treatment of a disease. So if it makes a claim, it needs to be supported by evidence. So say, for example, like, iron, for example, it is a mineral that's naturally occurring in food. It is a dietary supplement, but it can be considered as a nutraceutical for the treatment of anemia.
Yeah.
Is there evidence? Yes, we do. So there are also generally biomarkers we can actually measure to track our progress. So I guess, nutraceutical it's a bridge between nutrition and pharmaceutical, but it doesn't easily fall into a legal category of food or drugs. Yeah, so it's a bit of a gray area.
Yeah. So I guess what would be, say, for a person who is looking for a nutraceutical effect? So say, not necessarily to supplement a deficiency, but to, I guess, treat a particular symptom or to alleviate a particular symptom. What kind of things, I mean, because I know it is a difficult question because depending on which country you live, but what are some of the things to look out for if you're purchasing this on your own?
I would definitely look at, how the product is actually sourced, and like, I think in Australia, we are pretty strict, with the TGA. So it's very, very well regulated. So, if say, if you've got an iron supplement, it says elemental of,
right. Okay.
say 10 milligram, it would pretty assured that, it is such an amount. So the sourcing is really important. I guess, especially when you're looking at herbs. So that's quite a gray area. And so this is where, you're using a dry herb, make sure you ask about the source, have they been tested for things like heavy metals. So herbs, I find that, that's probably more of a challenge compared to, some of the, say, nutrient or nutraceutical stuff. And if you're using liquid herb, for example, be aware that, most of the time they're actually in an alcohol base. So how much of the herb are you consuming in a day? And is it potentially a problem? So I think, herb is a bit
That's
of
an
a
interesting
challenge.
Because in Australia, you've got the TGA for the regulation of other supplements. In Hong Kong, you have traditional Chinese medicine, which is also regulated here. So they have to undergo proper third testing for heavy metals and quality and purity.
That's great.
Which is interesting. But then when it comes to the other supplements, so say things like fish oil, CoQ10, there isn't really any kind of third-party oversight. So really, I think the only oversight is if something is contaminated with a pharmaceutical. So for example, because the weight loss drugs that are actually contaminated with something that's been banned called sibutramine. So that's something that we don't have here in Hong Kong. And so I think it's interesting. So I think, there's the consumer side. What do they have to be careful of when they're purchasing themselves? And then as a professional, if I were to recommend something, what do I look for in a supplement? So do you have any guidelines that you recommend if you're going to be suggesting something?
Again, we're really lucky in Australia because, everything is quite well regulated. So the other thing is, I tend to look at the company. So I tend to actually go for the more reputable brands of, say, supplement, and looking at their quality. And one of the things that that I look at is also, if the company is actually really interested in educating practitioners, especially, they're really, and you can see the integrity, and you can look at, they're trying to make the capsules more hypoallergenic, they're using all sorts of different technique and all that. So that to me always spells out that, okay, well, this is a good company, they have integrity and they really do care about integrity. And some companies what I find is, they're really just in for, because this is the latest bestseller product, and they'll make, usually a handful of supplement that is the most popular supplement. And so that just, that doesn't, generally doesn't sit well with me. And generally, that means that, they may I mean, I may be totally wrong, but it gives me a sense that they're not really as interested in sourcing the best ingredient for their product. They're more profit driven.
Yeah, because I think Australia, there are a lot of great companies there that have a really long history in providing really good or creating as new clinical data comes up. So I think this is an evolving field as well with supplementation and doing the randomized controlled clinical trials. These companies are invested in themselves, also like looking at what the research is, where the indications are, and then creating supplements that they have third-party testing that actually fulfill the potency criteria as well, because that's the other thing is if the supplement you're taking actually isn't the studied dosage, it won't really have the effect that you desire. So this is, I think, really important when we're talking about nutraceuticals for a specific goal. What was the actual clinical trial? What was the dosage? How long were they taken for? And what was the actual study population? Because I think that's really important for people to understand that, yes, they're easily available, but, you kind of need to think about the worst case scenario is there's no effect. However, well, the best case, what should I say? How to say it? You don't want to create liver damage, but you also be very smart about spending your resources, right? Because it is a resource that you have to spend. So I think, apart from what you said, as a provider, I also want to know, has this particular ingredient been adequately studied, and what is the dose? How long do you take it for an effect? Can I measure a clinical or a functional biomarker, or do I have to use a subjective, questionnaire, which are all valid, by the way, but I think it requires someone with training and knowledge in this area to assess for that.
Yeah. I think actually you brought up a point about the therapeutic dose, and what I find that's actually really super annoying is when I see a formulation and they have a little bit of everything.
Everything, yes.
But they're all subtherapeutic.
Yeah.
And so it's like, because as a consumer, they look at the ingredient and go, oh, wow, this contains this and that. And so they feel really confident and, they feel excited and think, well, this is going to help me. But when I then, when you really zoom in and look at the strength of everything, it's subtherapeutic, and it's frustrating to then, I find that I spend a lot of time explaining to people that, well, they have all these ingredients, but it's just, you probably need like 10 actual or something at a time.
Well, this is also
very frustrating.
This is also where I have a criticism about what's natural, right? Because people look at all these ingredients and they go, oh, that's natural, that's got to be really good all together synergistically. But when you really look at the clinical studies, none of them have actually been studied all together. So that's why I'm all about, if you're going to really be serious about taking a nutraceutical, find the right one with the right dose and try that first, because that's how people were like, that's how the test subjects were actually studied. Just because there's a whole bunch of them, more isn't better. More combination isn't better, because sometimes these nutrients can cancel each other out. Yeah,
exactly. Yeah. So another, because you were talking about, let's just thought about, the herbal patches. Yes, yeah. So herbal patches, and I've recently seen it on some website, for menopause patches, and it sounds great, terrific, patch. It makes sense because, you actually do bypass, like the liver. You should supposedly get better absorption, more efficient, and it's logical. So, but there's so many variables, with patches, especially because you then have to consider the pH of the skin, in the design, how it's actually going to affect the absorption rate, and how it's effectively going to permeate and pass through the skin. Given that, the outermost layer of the skin is lipophilic, like fat loving, and the underlying, dermal layers are hydrophilic, like water loving. So these herbs have to possess both lipid and aqueous solubility characteristics. And then you actually have to consider, because I was actually looking at this patch online, and the review, and I don't know, I can you trust the review? I'm not sure. And, you see this like really small patch, and it has like 6 herbs in this patch. So then I'm thinking, okay, well, then what about you got to consider the molecular weight of all these individual herbs. And then you got to go, well, how much ingredient can you actually fit into this specific area? It's the size of the patch. So, I'm not saying it's not possible, but, I just want to point out the sophistication and the complexity of a patch delivery system.
Either someone's did this amazing, miraculous patch delivery, which I honestly think if we had something like that, why are we not using it for medications? And we are. I mean, we do have, estradiol patches, and we do have patches in some countries, not all countries. But, even with just one single drug delivery, it's the amount of innovation that has to go.
Absolutely. Mind-boggling.
It's mind-boggling, right?
Yeah.
So
it's not simple.
It's not it sounds great. The idea sounds great, but I think again, I don't know, are you microdosing these herbs? Then do they have any effect? I mean, I question that, right? So
I'm sure, the technology will come, they talk about nanotechnology and all that. But, I'm just not saying that they don't work, but I'm just saying that, there's just so much complexity that goes into that delivery patch, the system itself.
And you want to test the bloodstream. Is it actually showing up in the capillaries? Is it showing up in blood? It's also one of the reasons why I think, if supplement companies are saying and making these claims, these are bold claims, they have to prove that the lab studies actually show that they are being absorbed. So I think it's being, it's good to question a lot of these things that seem to have great ideas. But we do have something for menopause symptoms that have some clinical trials, although they're small at the moment. But do you want to share what you talked to me about and what you suggested to me about the sea buckthorn?
Oh, right. Okay. Yeah, the sea buckthorn. So there's some trials so we're really talking about, women tend to have a lot of the vaginal dryness or atrophy. And so sea buckthorn is actually like a red-orange oil, derived from sea buckthorn plant. And so in some studies actually show beneficial effects on that mucosal membrane, of the vaginal cells. And so relieving that symptom of, the itching, the burning, the dryness, and the pain. So, but, bear in mind that, these studies are small. But, and of course, we certainly need to see more studies. But nonetheless, it's a good alternative, and it's worth a try, especially for, postmenopausal women who can't actually use maybe an estrogen treatment. So the oil itself doesn't actually have estrogenic effect. The improvement seem to be, on the integrity of the vaginal wall, and it's most likely due to the biochemical component of the oil itself, because it's rich in a lot of essential fatty acid, the vitamin A, the carotenoids, and a mix of, vitamin E. So it's and also other nutrients. So it's actually quite soothing, for these women.
Initially was oral, taking it orally as a supplement, but what you're talking about actually is to use it topically.
There is actually some studies looking at oral as well, especially women with I think the study was done on Sjogren syndrome. So they're taking I think from memory I think it's about 3 grams, but definitely you could use it topically as well. But keep in mind, it's orange and it's red in color.
Yeah.
So,
thanks.
No, so you might need to have a liner or something so you don't panic and go bleeding. So just keep that one in mind. Yeah. So, with the burning and itching, another less thought of product is, could be a postpartum cold pack. They're reusable and they could be quite economical, in the long run. And so, these packs can be used for 20 minutes at a time, and they can help to soothe pain, itching, and also, reducing that swelling too. So yeah, so those are a couple of things, and of course, like diving into like probiotic. As women, as we move from that perimenopausal to menopause stage, our vaginal microbiome actually changed. The decrease in estrogen in postmenopause can actually deplete our lactobacilli and increase that intravaginal pH. So resulting in that shift in a less desirable microbiome colonization. So very often, like, back to the, pharmacy setting, like I see again, like women who comes in, like in their, sometimes in their 60s or 70s, and they asking for, anti-thrush treatment. So that is also, that's where I like to intervene rather than going, oh, well, because if you ask, oh, is there an itching? Yeah, there might be itching, but, when you really dive into it, because it may not be thrush, and in fact, in that cohort, that population group, it's not very, I mean, it could be, but it's very unlikely that it is actually thrush.
Yeah.
So that's actually worth having that conversation as well, with these women.
Exactly, because genitourinary symptoms of menopause, the new term, saying it's vaginal atrophy, encompasses so many of these types of symptoms, the itching, but also incontinence symptoms, pelvic floor issues, overactive bladder. Like, I think one of the biggest issues is that it's not being addressed by the physicians, and sometimes feel very uncomfortable. They don't know who to go to see about that. But I think there's this sort of taboo as well, not talking about it. It's really tough, but vaginal pelvic health is part of quality of life. So I think it's critical, and recurrent urinary tract infections, like these are symptoms that we actually have to, as a practitioner, be aware of post-menopause, that they don't necessarily occur straight away, but over time, because with the loss of estrogen, the vaginal tissues and the perineal tissues become thinner. So the lining, the connective tissues are less supported, so bacteria gets into the bladder much more easily. So whether or not you're active, that can occur, and I think that's why it's so important that we ask about this. And I really like your approach. Trust me, I've seen everything.
Yeah, but I really try to encourage that conversation, and again, for me, we do have like a set counseling area that like we obviously got to be discreet about it as well, like in a pharmacy setting. And so, usually they just become really meaningful conversation, that I have with these women. And another like really interesting research is, to point out is the whole vaginal microbiome immune network. So, where they actually found very different vaginal microbiota depending on your ethnicity and also which continent you live in. This is mad. This is really mad. So no doubt we're going to see more individualized treatment down the track, especially when we see like unresolved issues of, BV, bacterial vaginosis, or even in infertility. So, definitely, watching this space, so super interesting, I find.
Well, there's the concept of the estrobolome. So the idea that the gut microbiota has an interaction in assisting the reabsorption of being secreted by our own bodies, and how much of that gets reabsorbed and recirculated has potentially a lot to do with our diet, with all the maybe even medications that we're taking. So I think it's a really interesting area of research, and currently there's so much data. I think we're going to need AI in future to help us interpret all this and make sense.
Yes, to make sense of it all. Yeah.
So finally, I wanted to ask, what are some practical tips and precautions for people who are interested in taking supplements, and what should they be watching out for when they're actually in combining medications with supplements, or just supplements in general?
Practical tips, and just knowing that when they're actually taking a supplement, that they're not going to be taking it forever. Sometimes, sometimes they, for example, they might be taking iron because they think that they're low in iron, and they go unmonitored and they just take it for years. And I have obviously, working in the pharmacy, I've seen that all the time. And when I ask, like, how long have you been taking iron? Go, oh yeah, forever, like, for years now. And go, well, have you had a blood test? Go, oh no, because the doctor said that I should take it. I said, well, how long ago was that? Oh, that was like, I don't know, 3 years ago. And so that's a really precaution that, and I think people have this concept that, well, it's not going to hurt, right? Like, I'm just taking iron. No, it's not going to hurt. But, of course, especially when you're taking minerals, you really need to monitor, because, obviously, like, you think of iron, like, in the environmental form, like, the rusting is one thing, like, too much iron, you can actually cause a lot of definitely. And it's also
right, called hemochromatosis, where these people are absorbing iron, and they get multiple types of liver diseases, liver conditions, symptoms. So you don't want to be taking these supplements long term, because these are toxic.
Yes.
So
so that's the main thing that, like, I like to draw, like, to people's attention, that, like, don't feel like, if you're taking one nutrient or one supplement, that you're going to be taking it forever. And it's always good to, just double check. Yeah. And, with a healthcare professional, or, doing a blood work, and to see. Another one is, vitamin D. I've come across someone who's taking 10,000 IU daily. And I have no idea how long they're, like, I'm a big proponent. I love recommending vitamin D, because I feel like, a lot of people are not taking enough, but taking that kind of dose for infinite time, is that a good idea? I don't think so.
I don't think so. I can tell you that, because even I recently had a patient who was on 5,000 units, and people these days don't bat an eyelid when they talk about thousands of units of vitamin D, but she incidentally had a test for something else, because she went to hospital for something else, and they found that she had really suppressed levels of PTH, parathyroid hormones. It was really, really high, and was on that dose for probably years. So even doses that you think might, the consumer, not us, but I think general public might not think is toxic, can actually become toxic after a period of time. So I sometimes like people to kind of, review their doses. And, I think because they're prescribing it to themselves, you kind of need to, they have to take ownership and educate themselves about these things. And so I often say to people, look, if you're taking a supplement and you want to know, what doses and what's safe, have a look at the National Institute of Health, because it's a public website where the Office of Dietary Supplements will list a number of different nutrients and ingredients, and you can actually read about the conditions, and so at least educate yourself. And the second thing is, go to a provider and find a provider who wants to listen to what you're doing and why, because I think people take certain things because they want to feel better, they want to take care of themselves, and I think it's a great
proactive
opportunity. If we don't open up the conversation and say, hey, why are you taking this? What's the reason and rationale with it? Can we, is it important to take? Because these days, I have people coming in with 10 to 15 supplements, like a whole bag of supplements. And I do a so I mean,
I've just recently gone through that, with a patient with a bag, and I had to go, well, it's like, oh, you need this, you don't need this, you need this, you don't need this. And also, of course, we talk about drug nutrient depletion. There's also nutrient, like, so for example, well, not so much like, as I mentioned about, the zinc and copper. But another thing, with the vitamin D, like high consumption of vitamin D, have people actually considered, the vitamin K. So vitamin K is actually really super, super important too, which almost acts like a traffic controller to actually really help with, bone health. So that's not talked about. And so, I feel like, maybe there is, a bit of an issue there, with high, high of everything for a long time without monitoring is generally not a good idea.
Yeah, because any supplements, I think one of the issues is liver toxicity. So I think some of the red flags to be aware of is if there has been any sudden persistent changes after taking a new supplement. That's important to note down. Any mood changes, any unusual fatigue, because these things affect the liver and the gallbladder. Definitely nausea and vomiting. So any symptoms that's persistent and doesn't go away, I think it's important to recognize. Maybe it's not the supplement, maybe it's a contamination, like I said before, because you don't know whether or not the quality is being properly tested for heavy metals and medications. So that's why it's important to consider contaminations as well with these things.
I think at the end of the day, it's really important that, like people do seek, a healthcare professional that they can actually work with and to really optimize their health. And, they don't have to do it alone. I know that there's so many Google website, ChatGPT and all that, people feel like, or listening to 10 podcasts and they feel like, they're an expert on certain areas. So I think, it's important to work with someone who actually know what they're doing.
I think it is a nuanced clinical skill to be able to be very mindful of how you are, utilizing supplements, particularly in people who also have multiple medical conditions, are on multiple different medications. And sometimes people think, oh, it's just natural and it's fine and I'll just keep taking. Honestly, I do think that there's a danger in that, because firstly, you're foregoing potentially good therapies that might be even better than the supplement that you're missing out on because it's not being properly assessed. So I think there's a lot of I think we need to talk about it more, because the reality is people are going to buy supplements. They're going to take it regardless. But how do they do it safely, under what guidance? And I think as health providers, we're in a unique position to be able to assist them, signpost them to reliable sources, and also educate ourselves as to, what are some of the complementary sort of supplementation that can benefit.
I think the last thing I want to say is that, people, I feel like sometimes people want to choose between nutraceutical and pharmaceutical. We don't have to make that choice, to be in this camp or that camp. We can always get the best of both worlds, depending on what your condition is. So I think that's really important to know.
Yeah, I do appreciate that a lot, because sometimes I think people are like, no, don't take these drugs because of, again, like we spoke about, these nutrient, impacts and it affects your gut microbiome. But when we actually look at some of this data, the impact is really small and only in specific populations like this. So if you're really unsure and concerned, I think it's important to talk to someone about it, because applications are, for example, we spoke a lot about the proton pump inhibitors for reflux. If someone actually has a condition which is eosinophilic esophagitis, a very specific type, the PPIs, the medications actually can put this into remission. So the quality of life gets better. They're not going to be symptomatic and it can be treated. But, if we sort of demonize these things, all of them, and just throw it all out, I think we're kind of really not harnessing the benefits of therapies. So thank you again.
Absolutely.
For knowledge.
No problem. Thank you for having me.
Is there anything else that you think we should cover that we haven't?
Yeah, no, I think we've covered a lot of ground today. Yeah. And so that was a very, I enjoyed the conversation. That was good.
And you're also online, so you have your social media, which I'll put a link down to. You also have a website where you write your blogs. So if you want,
which I'm not very active, so
don't
Because
don't
life just
the fact
becomes
that you're
really,
even
really busy.
on there. Can I say the fact that you're even on there, you're doing your part in providing credible health content and education. So
Yeah.
very much. If you haven't followed her, please
You're
follow her.
welcome.
Like information, so we can take up space on helping provide good information for everybody.
Yeah. Thanks, Laurena.
See you again soon, and
See
take
ya.
care.